Good evening, everybody. Good evening, our guests, guest speakers. Welcome to this very important session by the Spice Road South Asia for the World Mental Health Day. This time, the theme of the Mental Health Day is mental health for all, and also it has elaborated on the importance of kindness. So this time the session was organized totally by our Nepal colleagues. So I would like to thank Rupak and Roshan and his team for this initiative and making it a nice one. Let me welcome our three speakers, especially Dr. Raman Kumar, the president of Wankasa, then Dr. Vaikuntaraj Adhikari, professor of psychiatry in Nepal, and also Ms. Shahin Nafsa Siddiq. And especially I would like to welcome Dr. Pramen Prasad Gupta, our Wonka South Asia Regional Secretary as well. In addition, I would like to welcome you all, the participants who have attended the session despite their busy schedules. So without much ado, I would like to hand over the session to our hosts, Rupak and Roshan. I'll be joining with you just after seeing a couple of patients. So let's go ahead. Thanks very much. Welcome to the session. Let's have a very fruitful session from this point onwards. Thank you very much.
Now we'll start the section with welcoming the guest. The chief guest for today's section will be Dr. Raman Kumar.
Thank you.
He is the president of regional president of Wonka South Asia. He is also the founding president of Academy of Family Physicians of India, AFPI, and he is the editor-in-chief of the Journal of the Family Medicine and Primary Care, JFMPC. Thank you, sir. And we welcome our next guest, Dr. Pramendra Prasad Gupta. He is the regional secretary of Wonka South Asia. And
Thank you.
He is also the executive member of the Wonka Working Party on Mental Health and Wonka Special Interest Group in Emergency Medicine. And he is associate professor in Department of Emergency Medicine and General Practice at BP Korala Institute of Health Sciences, Nepal. Now I would like to welcome our next guest, Ms. Shahin Nafsa Siddiqui. Ma'am, are you there?
Yes, thank you.
She is the head of mental health and psychosocial support team at Bangladesh Rural Advancement Committee. Thank you, ma'am, for joining us. And let's welcome our another guest, Professor Dr. Vaikuntaraj Adhikari. Vaikunta, sir.
Thank you. Thank you for welcoming me. Thank you for giving me the opportunity. And let me just add, with your permission, if I may, that is that today is World Mental Health Day, and I wish each and everybody's health to be perfect, shining, and all that. So that's my good wish. Thank you for this.
Yes, sir. So he is the professor of psychiatry and also the head of Department of Psychiatry at BP Korala Institute of Health Sciences, Nepal. Thank you all the guests for being there. Now
onwards.
Hand over to Roshan, please.
Thank you, Dr. Rupak, for welcoming our guest. Now onwards, I will request Dr. Raman Kumar sir, who is the Wonka SAR president, to give a short speech, a welcome speech to all our guests. Raman Kumar sir.
Thank you, Dr. Roshan, and thank you, esteemed colleagues, speakers, Dr. Shahin, Dr. Baikunt. Thank you all organizers of Spice Route. It is really a pride moment for me, especially because I was also the founding chair of Spice Route. And I'm so delighted to see the progress of Spice Route, how you all are taking it forward in our different member organizations, member countries. It is indeed such a delight that you all are organizing so many academic events, workshops, webinars, even during the time of pandemic. You all have been very, very active, well connected. And especially today on World Mental Health Day is important for all of us. You know, it's just not a day for commemoration. It's also important for each of us in our individual lives, in our family lives, in the lives of the community which we serve. And no doubt that it is, being given due importance by the governments, by the non-government organizations.
Thank you.
So there is a huge requirement. So I'll keep my, I welcome you all for this session, and I'll speak more during the, talk I have been given, assigned to. Thank you very much.
Thank you, sir. Thank you for your remarkable words. Now I would like to request our Dr. Pramendra Prasad Gupta, sir, who is ONCA SAR Secretary, to give a short welcome speech from his side to all the guests.
Thank you, Rosen. Good evening, everybody. On behalf of ONCA South Asia region and ONCA Working Party on Mental Health, I welcome you all in the webinar Mental Health for All, Greater Investment, Greater Access, organized by Spice Route during World Mental Health Day 2020. The importance of mental health and well-being, as well as mental stress and its consequences, are felt more heavily during this pandemic. The realities of human fatigue and helplessness we face across the globe leads to people realizing more importance of mental health and well-being. Hence, there is more need to work towards greater investment and greater access towards mental health for all. Let's welcome our speakers of today's webinar and be part of this great webinar organized by Spice Route. Thank you.
Now, without wasting a time, let's move on to the proper session. So our daily lives have changed considerably as a result of COVID-19 pandemics. The physical stress apart, the fear and the mental trauma due to COVID-19 is profuse, be it for healthcare professionals, be it for a general public. So our first speaker will highlight on the topic COVID-19 and mental health. So let's welcome Dr. Raman Kumar for this topic. Up to you, sir. Raman, sir.
Thank you very much, Dr. Roshan. I'll be sharing a few of my PowerPoint slides. Can you all see my PowerPoint?
Yes, sir.
So I bring greetings from the WOMCA South Asia region, from Academy of Family Physicians of India and Journal of Family Medicine and Primary Care. And as you know, WOMCA is the World Organization of Family Doctors. We are representative of family doctors across world, all continents, almost all countries, and we work together as a team. And today we are here to recognize importance of mental health. I mean, it has to re-emphasize, we all know about its importance. So I'll be taking you through, I will not be taking a conventional academic lecture. I'll be talking about some philosophical things, some important deliberations, some experiences from my own life as professional leader and as part of this global group. So it is indeed a great disease entity, a medical entity for all of us to be aware. There was a paper published in World Economic Forum, Economics of Non-Communicable Diseases in India, because India is one of the largest country in our region, most populous country. And this report published in 2014 says that India is set to lose around $5.5 trillion due to non-communicable diseases and mental health only by 2030. So you can see how huge is the loss if we do not address both non-communicable diseases as well as the mental health issues in terms of financials. And we understand how it impacts individuals, our own lives. If somebody is inflicted in our families or ourselves may have mental health issues and challenges. So morbidity is one part, and this financial burden is, of course, is of great and grave concern across world, or also in part of our world. And it is said that by 2030, around 20% of the mental health issues will be from, you can say, India or largely South Asian population, if you look at the population thing. So we are going to contribute around 50%, 20% of the mental health issues globally. And we are around 25% of the human population in South Asia region. And mental health is largely underreported. It is not acknowledged also. And given this COVID pandemic time, the whole differential paradigm has shifted, changed because of the lockdowns. Everybody's all lives have been impacted. Their livelihood, education system, how children have been living in our societies, how people go out for the vocations and occupation, and how the governments run their business. And this is, each and everyone's life is impacted, and not just impacted for once, but we all are uncertain about what is going to happen in future. So there is a lot of stigma around the disease. The people who are being isolated, about the quarantine, about getting the disease. And since there's no definitive treatment or cure for the disease, we are also worried about the future, what will happen in future. So COVID times has given a special time, and its problem has aggravated beyond its, and it is time indeed to think, emphasize, especially this year, that mental health is important. And it's like chessboard, and out of blues, suddenly our lives are haywire, and we are struck. And this can happen in anybody's life. COVID is one international global event, and we all can relate to it. But mental health can impact like this to anyone's life, personal life, family life, social life, and this can happen anytime. And life is so uncertain. Even during the non-COVID times, we all have played this game of Ludo, and we throw the dice. Any number can come, and any permutation and combination can happen. So it is so uncertain, and this external environment uncertainties impact our own mental balance, physical balance, our physical health, mental health, all is disturbed. And through our lives, since we take birth and till we live our proper life, through our life cycle, we are challenged through various life events, which are anything can happen anytime. So that uncertainty is aggravated, compounded, especially during this time of COVID. So as I said, I will not be talking about general theoretical things. We can find definition and treatment of depression, mood disorders, personality disorders, schizophrenia, all of these things, anxiety, neurosis, and all these things in textbooks. We all have been reading in our textbooks. We are all grown-up adults. We are all professionals. So, so it's broader sense. What is life? What is the philosophy of life? I'm going to talk about a bit, from my own experience and what I understand. I, wish to discuss with you all the journey of life. As we know, we start growing older, and we all have limited lifespan. In South Asian context, we have a lifespan of around 65 to 70 years, and there is a pattern of this life, but often there are certain uncertainties. And we live as a social animal. Man is a social animal, we say, but at times we have to take our own burden of our body, our own responsibility of our finances, our families, our countries, our communities. And at times it becomes so burdensome for many of us that we start feeling that we have been entangled into some kind of problem or some. And we all know, we have constantly to find our way through the struggles of life. Always there is something new happening, and we have to find our way out of it. And this is one of the most important life skills. Mental health definitely has a biochemical element. It has a genetic element, a lot of hormonal and other things, chemical, what you say in your body is happening, and that is definitely requires medical treatment, medical attention, counseling, and all. But largely, it is the impact of the environment and interaction with the environment that we have to learn, and it is the life skill which will help all of us, not just medical professionals, but also general community. And often this part is lacking how to live life, in practical ways. We read textbooks, we do courses, we get qualifications and degrees, we get posts and positions, but nobody teaches us how to live life. Life which is full of struggles. And many times people are broken. Many times they are disheartened. Our esteem is lost. Our tempo in life is lost. Our interest in life is lost. So it is important that we understand what is life, and in general, I mean broadly, if just deduct it, it is a balance between personal and professional life, because we have our personal life, our physical life in our families, and lastly, because we are social animals, we have to learn our livelihood. We also have a professional life. Everybody has a vocation, a vocational identity, and everybody has a personal identity, and it is a balance of the two. So we all have dreams when we are children, when we are younger adults, adolescents, when we are growing up, and we follow these dreams through our life. We try to achieve them through our education and work. Our family is around, and we get benefited from our families, our community, and we also contribute to the well-being of our families and community, and we try to reach our overall goal in life. But many times these goals are not understood. At times we think examination or a gold medal in a subject, for example, in our professional courses, or high marks in one of the examination is a goal of, this is not goal of life. These are simple objectives or milestones. Being a very good high school topper or higher secondary topper or entrance examination topper, or getting a very high salary job. These are all objectives. These are milestones of our life. These are not broader goals. So we must have some philosophical outlook, what in general we understand from our lives. And we can learn from animals also. Animals live in their group, and nowadays we talk about herd immunity. So herd is what? It is a community and group of animals. We heard of elephants. And similarly, we live in society. And as we go through our education and employment, many times we are isolated from our own society, own community, own culture, and we start living a different life. There is a delineation in what we do and where are we from, and it is important to keep our links within our life very strongly anchored where we live, in the society we live, in the neighborhood we live, and it is important that we also take interest outside. So by nature we are self-interested people. We are always fighting for our own survival, but our own survival is dependent largely on the support of other people, our own broader community, neighborhood, society, our families. So important to take interest in others' life, to contribute to the outside life, and this is very fulfilling. If you're just looking for your own benefit, your own progress, your own success, this will not happen. Your success is largely dependent on the support of other people in our life. So broadly, I'm talking about, we are trained for long years. Our MBBS course, 5.5 years, then we do house jobs and all, and then we go for post graduation, and at least it is a 8 to 10 years long training. And this is so long that we many times we start living life which is out of society. When we complete our studies, we live a different professional life which is different from our original family life, or the place we come from, the city we come from, and we altogether change our lives. And many times we live this life as an expectation of others, because our own identity, many times, I'm an Indian, I live in a particular city. This was not my choice. I am born like this, and I have a religion, I have other identities, and these are the identities given by the society. These are not our own choices. So many times we are living up to the expectation of our society, what we are from. So it is important that we also learn other things apart from our textbooks. I'm talking from the perspective of doctors, medical students, young doctors, spice route, that it is good to be good in academics, but it is important to read outside textbook and enrich your life and develop newer skills, different skills, broader skills in our life, because our medical education makes us to think life like this. Human health is largely fragmented, and this comes from our MBBS training. And but to a individual, human health is, overall, it's a wholesome thing. It is not a department part of the body. So mental health is not isolated from the overall well-being of human being or human health or physical health. It is part and parcel of the overall package that we live in. So we need to think outside of this, frame which is given by our traditional medical education system, which is fragmented at large, and mental health should be integrated. And who else better than the family physician, GPs, can understand this concept? So I'll just briefly talk about, this is one of the books I recommend you all, 0 to 1. And this is about philosophy of life. It is about, not about medical education, it is about entrepreneurship. And this book is by Peter Thiel, who is founder of PayPal company, one of the initial online digital payments channels from US. And he was also a partner with Elon Musk. I'll talk about him later. And he says that this, lifespan is a horizontal plane, and we move from zero. We start as children and we end towards older beings, and we have a limited lifespan and we die. So life is between 0 to 0. So whatever we do ultimately becomes zero. And in this life, we are given by the society certain milestones, like, passing your high school, getting a good education, becoming a topper, and, becoming a good professional, a successful professionals. And these are all traditional thinking of spending life. And what Peter Thiel says about the traditional life choices is that there are two disadvantages in this choice of, living a horizontal life. Number one is it is very competitive. You think that you pass your high school and life becomes better. It becomes more difficult. You pass your +2 higher secondary, it becomes more difficult. At the next level of professional training, it becomes even more difficult. During the professional training, you start feeling the heat of the education and how burdensome it is. It may become many times. And we complete your education, the real life begins after that, because that is your professional life. So it is very competitive. And second, it is financially not very rewarding. You can be can be topper of your school or college, your class, but it does not solve your problem of life. Rather, you get to the next level of life where it is more competitive. So it does not guarantee you a very good financial, this resources and options. So what he says, what is the alternative? He says that rather than doing traditional thing, it is also good to take a vertical lift off. Vertical lift off. You do not have to jump 0 to 5 or 0 to 10 or 0 to 100 or 0 to 1000. You just have to deviate a little bit. He says 0 to 1. If you deviate just little bit out of your traditional pathway, you can create huge, you can do a lot of contribution, a lot of new things. And this is the philosophy of doing the alternative things in life. Another thing is we are always worried about what is in the future. What will happen in future. This is one of the major reason for the anxiety. And among many types of people, what will happen financially, what will happen in my family life, what will happen to our children, what will happen to our country. We are always worried about our future. So while we are worried about our future, there are people who are creating future. So many of us would know Elon Musk. I mean, I highly value him in the present. Everybody knows his role. So why he is important? Because he is creating future. He's not thinking about future, what will happen in future. He's creating which our future generation of humanity is going to live in. So how? He's talking about the company he once when he found is SpaceX, is about commercial space travel, and to whom he's competing. He's competing with NASA, he's competing with the Russian Space Agency, he's competing with ISRO, Indian Space Agency, and he's doing it is in a private capacity. So you think the imagination level of you can think of. So we have to think out of box, out of what our conventional life, and we are stuck in अभी जीपी का क्या होगा, अभी जीपी का क्या responsibility है, हमारा क्या होगा, and kind of things. He has found another company which is called Tesla, and where he is talking about petrochemical free transport system. So this is what where he is talking all electrical cars powered by solar energy. And traditionally our whole motor industry and transport system is petrochemical based, and this is what is happening in Middle East. And he's talking to break and the whole system and taking the humanity to the next level of traveling into electrical cars powered by solar energy. That is not the only idea. And lastly, one of his idea is the Boring Company, and he was once struck in one of the traffic jams in United States, and he started thinking, why don't I dig a tunnel here and get out of some other place, my destination. And from there, he started thinking of futuristic hyperloops or future hyper transportations. So own lives, there are people who are creating future. So Elon Musk is one of the examples. Other people we are now. There are people who have created Facebook, global networking. There are people who have created Google. So in our South Asian context, we are largely very traditional people. We do not think out of box. We do not think innovative. And it's important for the youth to think out of way, finding solutions. This is the key of life. And this is also key of mental health. If you are unable to find solution for any of your problems, it will impact your mental health. And this is one of the, person from South Asian, Delhi, and he is one of the large, also founder of Sun Micro System. And he has written a lot of things on medical and healthcare system. And he's written many futuristic things about medical profession. So he says in one of his articles, do we really need doctors, or are we going to have algorithms, because artificial intelligence is developing? And he says, very controversial things like, there's no reason that an oncologist should be a human being in 10 years from now. So because everything is now, data driven, AI driven, it can be done by nurse. Why do you need an oncologist to treat, give some chemotherapy, decide on chemotherapy? It can be done through an algorithm. He also says the radiologist still practicing in 10 years will be causing deaths, because all these MRIs machines are software driven, and software is advancing each day. And if there is any human interface, it is likely to cause some error. So he's saying that human interface is going to decrease. This is how people are creating future. So if we are struck in the situation, we close our mind, we don't open up to what is happening globally, not only in the area of health science, but also in general, in the future of humanity, we will always be struggling. And this is important in South Asian context, because many parts of our region were colonies of the British, and we need to grow out of this mentality of following. We have to be equally creative and contributing to the world. So few more slides. We are all in different occupation. We just not have to find solutions in our own occupation, but also in general life. And medical expert does not necessarily mean a treating doctor treating disease. We have to be communicator, collaborator, managers, scholars, health advocates. So we have health as well as mental health of the community which we serve. And as I said, solution finding is the most important. Learn this skill of solution finding. We will not be able to sustain properly, sustain our life. The problem solving is very important, asking for help. And as I said earlier, our life depends on the help of others. Our success depends on the help of others. So we have to ask for help. We have to ask for support. Never feel any ego or any shame. Ask for guidance. Ask for tips. Ask for assistance and advice. Always be open for asking for help from anyone. And in our South Asian context, we are family people. Our biggest resource is families. And we have to depend in all dimensions of life. We can, financially, emotionally, in the relationships, and we must value our family system, because this is one of our strength of our cultures, common culture in South Asia. And this is very important for mental health. And family stress can, if there is any family discord, any relationship problem, it is, becomes a huge impact on anybody's life, on mental health. I'm all talking about the external factors. I'm not talking about the pharmacotherapy and all those things. And this family thing, and in the COVID times, we all have come together. We all have realized the importance of families again, because we are living with our parents, we are living with our children, we are spending more times with our spouses. Another thing is important for any phase of our life is, relationships. This is another aspect of, mental health. And we must be consciously building relationships, fixing problems, and remove any stressors in the relationship. This is very, very important. Be friendship. Why do you want a bad relationship with your own friend? And why you want to have an enemy for any reason? Why you want to have a competitor in your own profession for any reason? So relationship building and positive is very, very important. And most important, there are many mental health issues because of, I'll take just last few seconds, is financial well-being. We learn about the art and craft of medicine, our own profession and vocations, but we are hardly taught, and we do not take interest in learning financial skills. So one of the books I recommend to you all is by Anil Lamba, Romancing Balance Sheet. This is a common or management course. Able to manage your own finances, you will be always under mental stress. So learning financial skills is again very, very important. And how every decision in life is a financial decision. And family physicians, as we know, are, we have not just depth, we also have range, and we are capable of understanding and providing a better interface in the society. And there are specialists. Of course, we require specialists, mental health experts, psychiatrists, but this is also the role of generalist family, because we have a different horizontal interface with the society, and we have a role to contribute because of the given population we serve to. And generalist, we can be, we can say that mental health is not our domain. And it is often said that, GPs are like, jack of all, master of none, but genius of all time. Leonardo da Vinci was a greatest human being considered, genius of all time. And he was a generalist. He was not a specialist. And he excelled in many domains of knowledge. You can see all of them. So we all have a role, and a proper role in mental health also. And this is all from my side. Thank you all for listening to me patiently. And once again, thank you on the behalf of Wonka South Asia. Thank you all.
Thank you, Dr. Raman Kumar sir, for talking on multiple spectrum of mental health. And now onwards, I would like to request our next speaker. She is Madam Sahin Nafisa Siddiqui. Now I'd like to hand over mic to our respected madam for talking on the topic investing in primary care to strengthen the mental health. As you know, the theme for this year, World Mental Health Day, is mental health for all, greater investment and greater access. Now we'll be talking on investing in primary care to strengthen the mental health.
Thank you all. Good evening to all of you who are listening to this program today. I'm representing Bangladesh, and it's a pleasure to be with the Wonka colleagues tonight. And this is many more chances to take part in discussions and go forward for many more collaboration. So I will actually start with some very common scenario in Southeast Asia that is making mental health a very important area to intervene at this point. As you know, this Asian and especially South Asian countries have many things in common. We are densely populated and we have troubles like the natural calamities, especially for the climate change has caused so many changes recently, like flash flood and landslides, or the dot or the kind of storm that Bangladesh usually get. Is really getting the life very difficult for many who has to migrate from one place to another. Even if it is within the country, it is a huge change in their life, and all these are affecting their mental health. Then again, we have this thing going on that women have been oppressed for generations in this continent, unfortunately. And although we have been able to mitigate much of these effects by the empowerment of women, by promoting the education in girl children, but that empowerment has not been able to mitigate the violence against women. Neither has the violence against children has been cut down to subsequent amount. And that just shows us how terrible the life has been for many women, that the struggle is still there, the domestic violence is there, the violence against women is there, because we get to see all these newses of the trafficking of women and trafficking of children, and all these things. The survivors of trafficking, they go through terrible life and comes back with horrible traumas. So being the people who are at the edge in terms of resource, many of the South Asian women have been subjected to trafficking, and nevertheless the suffering continues throughout the generations. So I would just like to say that mental health has been a very important issue in this continent, and so far we have been trying to mitigate many of the troubles that have been caused, but mental health still continues to be an important area to reflect and implement within our health policies, and especially if we say that we want to bring more focus on mental health at the primary healthcare systems, then I would just like to discuss a bit about how the primary health system has been taking part in health sector, and how it is facilitating people's option to have an access to health as a whole. So if we look back to Sri Lanka, it's more or less like 37.9% of Sri Lankan population have an access to primary health care, whereas the percentage of people who are taking an choice of having an access to tertiary level of health care is really minimum compared to that proportion, because it's only 13.2% of the total population. If we look at Nepal, I would say Nepal has done a tremendous good job in terms of providing I would say health facility for all, as they have started to promise for health for all in 2015 in their constitution. And Nepal has done a good job because they have actually focused more on training people from the community, building on the capacity of the health workers as well as the professionals, and blending this mixture to provide both the tertiary level and the primary level of health sector to be in a balance and to be more self-reliant. So this is amazing what Nepal has done so far. And also what Bhutan has done in the recent years, like 90% of their people have an access to primary health care, and also like it's about 187 primary health care clinics are there in Bhutan. So it shows that ever-growing need in primary health care has been spreading all over South Asia. And of course, Bangladesh has taken great step towards promoting the health infrastructure in the recent years, as well as in the years before 80s. But Bangladesh recently has taken few steps forward towards implementing the primary healthcare system into the healthcare system, and they have been progressively trying to bring more change in the primary healthcare sectors. And Bangladesh actually has 13,000 primary health units that are the community clinics, and about each one of these clinics tries to serve about 6,000 beneficiaries per year. That is their target. So in a recent survey, it was a longitudinal survey, and in this recent survey, the WHO has seen that this training and capacity building of community members, and which has actually introduced a whole lot of empowerment to them, and also building on this primary healthcare system has brought a lot of improvement to Bangladeshi health system and infrastructure, where primary healthcare has been really implemented well. Also, in a recent survey, the USAID has found that the primary health sector in Bangladesh has been achieving many more beneficiaries than before. And this has been a tremendous job done by the initiatives where the Bangladeshi health sector has been promoting and focusing on maternity health care as well as child health care. And they have really done a good job by training the midwives and nurses and paraprofessionals like paramedics. And we actually do have a huge number of paramedics working at the health facilities. So are the midwives. And through doing this, I would say Bangladesh has achieved a great level of success at the point of ensuring health for all, because the infant mortality rate has gone down because immunization has been taking place much more rigorously than before. Then maternity health care has really received a great deal of attention, and this training of the midwives and the nurses has brought, also the paramedics have brought this entire professional system, or the primary healthcare system, to a point where we can actually say that Bangladesh has actually achieved a lot in terms of providing the basic health to its population. But as you know that compared to other countries, the applied branch of psychology or mental health care has been pretty new in Bangladesh. But it has flourished a lot. We have really great professionals here, and they're doing great jobs. But unfortunately, the number of psychologists is very small compared to the entire population of Bangladesh. So we have actually 1,000 psychologists at the moment, and we just have 200 psychiatrists to cover the mental health services for a huge number of population, which is about 16 crore, which is 170 million. So that's kind of a huge population to cover for just 200 psychiatrists and just 1,000 psychologists. So at this point, I think we are at a great need to decide how to implement this entire mental health system and the services at the primary healthcare sector, and how to bring the quality of service. Well, I mean, we have to integrate mental health into primary care, but at the same time, we have to ensure this quality of service in mental health care. Because when we are dealing with mental health need, I think we are in a position of taking more responsibilities, because in case of physical need, the person is in a state where he or she can actually understand or have the insight of what's been wrong, and he or she can express to the caregiver about his or her need. But sometimes the mental health client might have the insight, and sometimes they don't have the insight. They're not able to express their need. So it's a great deal of responsibility when we are dealing with this mental health care client. And thus, we have to be very careful in terms of handling our clients, and we have to ensure the best ethics and best service to our clients. So that is the challenge, how to integrate mental health but provide quality service at the primary healthcare system. So I think at this point I can share something that my organization has been doing really religiously, if I can say, and that is BRAC's wonderful work with the Myanmar nationals. As you know that Bangladesh has been there for supporting this Myanmar national who had to flee out of the violent situation in their country. And at that point, you know, many international organizations was working together, but it was felt that besides providing the shelter, health, and other facilities and supports, it was a tremendous need. There was a tremendous need for mental health support. It was actually prime focus for Bangladesh to just settle them down somehow. And BRAC at that point decided to provide mental health care for all these people. And this Myanmar national actually suffered from a tremendous amount of trauma, because they have experienced the loss of their families, loss of their children or elderly family members. They have experienced brutal murders of their family members or relatives, and so much more. So the first thing that came to BRAC is that we have to provide mental health care to them and settle them down for further care and support and introducing further growth in their life. So as I have already mentioned, that Bangladesh has only 1,000 psychologists and 200 psychiatrists at the moment. So it is pretty much impossible to provide the tertiary level of service at the camp, but BRAC has made that impossible possible in a manner which actually introduced to train the people from the community and the host who were actually available at that point. And we have just taken community members, especially women who were interested to be trained as para-counselors. And these para-counselors are working really tremendously at the field level. And we have also a very systematic method of developing on their capacity and supervising their activities. And that has been possible only because BRAC works in a certain manner where we have this 3-tier model, where we have the para-counselors from the community who works at the community. They do have this door-to-door service system, and when they identify a client, they provide psychosocial support for mitigating the distresses, and if they stumble at some point or finds it difficult to address a client, they just come to their second tier, where we have the psychologists working closely with the para-counselors. The psychologists are the brilliant people who have been taking responsibility for building these para-counselors. They rigorously train these para-counselors and supervise for each cases. And when they find that something is difficult for them to address, they receive regular supervision from the mental health expert, and the tertiary level is covered by a mental health expert. And this mental health expert is responsible for building the capacity of the psychologists as well as supervising their case supervisions and case interventions. So it's rigorous process of capacity building and supervision, and if I can say, looking into the situation of mental health in the camps, both at centers. We do have centers for mental health interventions, as well as we encourage the para-counselors to have a door-to-door visit. And that is one of the main focus for BRAC, because we figured out that when a person from the same community will be visiting them and offering some support, that is more well accepted, because these are the people who have been forcibly disrupted from their own land, and definitely they have this feeling of insecurity, and also there have been some reservation in especially for the women to come out and talk to the outsider. As you know, there are very conservative systems in some of the part of the community. So when we introduced the para-counselors to be the main mental health support provider, it was very well accepted, because they were either from the community or they actually speak their language. So also it made them very well accepted, and it was also easy for the para-counselors to understand the cultural nuances of this community. So I think this has worked really well so far, and it is something that we can think about to adapt all over South Asia, because this is something that will take less resource in terms of how much effort we can put to train the para-counselors or the paraprofessionals, and we can just administer so much training and building on capacity with limited number of psychologists, and build on building more capacity in the community. And that has also introduced an empowerment on part of the women in this community, because they have shared that their position in the family has totally changed, because they have been an earning member in the family now. And also the way their community observe them is they respect them, because they are people who kind of manage their distresses and mitigate their problems and ensure their well-being. So it's been a win-win situation for the para-counselors, both at home and in the community. And it's been really an effective model for building in the primary level of care, also providing the tertiary level of quality in care. And I think this is important to mention, that during the COVID, we have actually included our para-counselors to provide service to many other frontliners, like the health workers and play leaders. Like we have early childhood development sectors in BRAC, and those para professionals are also very well trained, and para-counselors were at some point providing support to these people. So as a whole, they have achieved tremendous amount of skill, because we have been able to transfer many micro skills to these para-counselors during the last few months. So it's a proven model to be implemented and ready to be implemented at the primary level of healthcare. And I would just like to say that this is just the journey, the beginning of the journey with Wonka, and I hope that I get more opportunity to share our works of mental health, and especially our works at the primary healthcare service level. So I would be just delighted to have more chances to discuss our works with you and to let the world know the brilliant works and the wonderful works BRAC has been doing. Thank you all. Thank you.
Thank you so much, ma'am, for your insightful talk. Indeed, strengthening the pillars of the primary care will boost the mental health of the community. Thank you for your talk. And now coming to the third speaker now. Health or well-being is incomplete without mental health. So WHO describes health as a complete physical, social, and mental well-being. So mental wellness should be integrated into the health for complete well-being. So may I now call upon our third speaker, Professor Dr. Vaikuntaraj Adhikari sir, to talk on the topic integration of mental health into well-being for all. Over to you, Vaikunta sir.
Thank you, Dr. Rupak. And I think you made my job easy because one of the slide contains that definition of the WHO that you said. And before I speak about the slide, is my slides audible, visible? Dr.
Yes,
Rupak?
sir, it is visible.
Fine. So I think it was very interesting for me to listen to the sir about the wise things. And, during this pandemic has created a kind of an environment where this is even more relevant. And it was good to listen to the different kind of activities that happened in Bangladesh from the madam. And I thank Wanka for making me a part of this. So I think whatever sir said in the beginning before my presentation, I was wondering that whatever I'm going to say, I think are there, sir already said, but it will be a kind of a different organization of my own to share the same thing. You see, when I saw that this topic first, integration of mental health into well-being, now, as sir rightly pointed out in his talk, that traditional way of looking at things, doing things, living life, practicing medicine, whether symptoms happens in a person or a person is a typhoid case, all that's kind of a thing, being traditional. So we are acutely aware that we are not able to help our clients to the extent that all of us want in order to do that. So I think that raises a kind of a question, what are we missing here? And are there other ways to look into the overall health in a holistic manner? So from there, I think we go to this one. But before I go into this, what also I would like to see is that if I don't have a mind, then I think that makes me a robot. So I think as a me personally, everybody I see they are actually an integrated existence as a whole. But during the time, I think with the traditional way of looking at those things, probably we miss that there is a human being inside there. During the service, probably it was not possible to cover all those areas that is needed in order to enhance the mental well-being. So when I was going into this, we are already integrated, but the services, all those things has not been able to be integrated, or let's say the collective effort hasn't taken place in all sectors simultaneously. But this is a real issue because without addressing mental health and into well-being, we cannot achieve ideal society. So one of the definition that I found about, so I think this was already said. So this health and well-being is beyond, it is conceptualization is beyond physical and mental condition. There is something to look into. And I think it compasses from the traditional role. I think we will find that it is such an expansion in almost all areas, like emotional, social, economical. Sir talked about some economical issues, occupational, intellectual, and spiritual. Simultaneously, it also talks about security, prosperity, sense of connections, and purpose of living at an individual level or at a community level. So this term has been, singular term. This health and well-being is taken as a singular term because now it is very difficult to separate the two because they both affect each other. Well-being affects the health, health affects the well-being. But rather than health alone, it was found to be more unifying and motivating pursuit. And it operates at various levels and settings. And this is both a determinant and outcome of health also. So how this singular term health and well-being is defined? So in a simplistic manner, how people think, feel, and they function, both at the personal level and a social level, and how they evaluate their lives as a whole. So how broad this idea from this traditional idea? So I will highlight some of the things related to this concept. It envisions about a kind of an environment where there is a possibility of achieving the full potential at the social level, at the country level, at all levels, state levels, at public levels. In order to do that, understanding of the society's values and pursuit of equitable living conditions very important to execute that in that particular place. It envisions this health and well-being as equally shared responsibility of all. I think that has not been able to take place so far to the extent that we want. It requires multi-sectorial collaboration. And if just, I think whatever we say, that is going to be correct. What affects is behavioral, psychosocial, socioeconomic, cultural, political, and a simple thing, including food, housing, transportations, and we can add the list. Saying the same thing in other ways, that when you look at the environments, all kinds of environment affects the well-being. If you look at the settings, even when we look at one particular individual, where that person is born, where does that person live, about the learning, work, play, worship, and in which setting we are aging. And there are, I think, many more factors for that. So in this regard, I came across one program like Healthy People 2030, and its framework, I will briefly touch upon its framework. And the vision of this was a society in which all people can achieve their full potential for health and well-being, not just to one particular age group, but across the lifespan. So this framework was supposed to be the fifth decade of the US initiative. It embraces and emphasizes this concept. It highlights on physical, mental dimensions in order to achieve that. With these dimensions linked with the efforts of achieving promotion of health and as well as prevention of diseases. But this framework also focuses on attaining health literacy, eliminating disparities, lowering the cost, giving other social benefits, and ultimately achieving this health equity. It talks about that shared responsibility, collaborative effort. And what also it highlights is that maybe it's very difficult to achieve until this is also an essential element in their day-to-day decision making and during the policy formulation, if this is kept in the mind. So in this, I will just share one more thing with you, and that is, I came across this stages of self-awareness on the path to well-being. So when we even look from the mental dimension, we will find, so it basically talks about 4 stages. For example, unaware stage. We are mature, we're seeking immediate gratification, we're like babies. But when we slightly grow, then we become purposeful, we can delay the gratification, some negative emotions can come. And later on, the person becomes mature and it is allocentric. They become aware of their own subconscious thinking. And another stage is contemplation, effortless calm, impartial awareness. So these are the stages to the one of the described pathway to the well-being. In order to achieve that, as an example, some of the modules that were developed were 15 modules like this: recognizing the happiness, recognizing the unhappiness, uh, looking for that experience of well-being. Cultivating soulfulness and all those things. So this was one proposition how we can do that. They have written a book on that, but some of the suggested, let's focus on the positive mental health versus disorders alone within the psychiatric theme also, because let's look at the whole human being in a holistic manner. And it's not that somebody doesn't have positive emotion. One of the RCT had shown that it is possible to cultivate the positive emotions. And now there is a lot of stigma because we have got categorical diagnosis. What is the validities? We are still working on that. So rather it talks about focusing on the universal interventions to cultivate mental health, making programs like that. An integrative biopsychological treatment, as Sir also mentioned in his talk, that it is fragmented. Now the treatment for a patient is fragmented overall, but within the psychiatry also, I think it is to some extent fragmented, and cultivation of spirituality. So again, I repeat that I think we are integrated as a human being. We have that experience, but the present health delivery system cannot cater for all those important areas. So I think this is a need to integrate mental health into the well-being. About the services, Madam also talked about the integration of the services, but this is at the overall level as a society when all stakeholders are needed to do that. So in short, they are inevitable part. So the current, a lot of dissatisfaction can be taken care of when we integrate mental health into well-being when we deliver. Thank you so much.
Thank you, sir. Thank you, sir, for your well presentations on this topic, integration of mental health into the well-being for all. As you know, now we have to look for we have to look this human body into a holistic approach and as a wholesome approach, not only the fragments of the disease and the organ systems. Now, with this, I would like to thank to all our speakers who have presented on different topics and guided us on with the different spectrums of the mental health. Now, I would like to open this floor for this question and answer session. If any of our participants, panelists, do you have any queries or any questions to our panelists and even any queries from our attendants? Now the floor is open for you all, and we will be very happy to welcome all your questions and for active participation, please. Now, thank you all. Now, without any delay, we are moving ahead towards the concluding these sessions. And to conclude this session, I would like to request for this session, to conclude this session, I would like to request Dr. Zainab to give his vote of thanks to all our participants, to all our panelists, and please, Dr. Zainab.
Thank you, Roshan. On behalf of the entire Spice Route team, am I audible?
Yes.
Okay. Okay. On behalf of the entire Spice Route team, I would like to thank our speakers, especially Dr. Raman, for giving such an inspirational talk, Dr. Baikunta and Ms. Shaheen Nafisa also for giving such inspirational and useful talks on the World Mental Health Day. Especially considering the background of COVID-19, as we all know that we all can see that the world is facing like big financial and emotional crisis also, which eventually has led to the rise in the mental health conditions. So thank you so much everyone for giving such wonderful speeches and celebrating this day with us today. A very special thanks to Dr. Pramendra Prasad for his support in joining us today. Also, a very big thank you to all the seniors, mentors, and young doctors from all around the region, India, Bangladesh, Pakistan, Sri Lanka, and Nepal, and Bhutan for joining us today and celebrating the World Mental Health Day with us. Especially a special thanks to Rupak and Roshan, the Spice Route Team Nepal, for arranging such an amazing event today, and Sankha for his guidance and motivation always. Thank you everyone for being with us today, and stay safe and goodbye. Thank you so much.
Thank you so much. Now we have come to the end of the session. It's now time to say goodbye. Thank you all the panelists and all the audience. Thank you so much and have a good night. Thank you.
Thank you, Yonka. Thank you, everybody.
Good night. Thank you.
Thank you. Bye-bye.